I'm KHOU 11 Morning News anchor Kimberly Davis. The recommended age to begin screening for colon cancer is 45 years old, but colon cancer is rising in young adults. In our series with UT Physicians, one young patient tells me his lifestyle may have contributed to his diagnosis and shares his grim warning for other young people.
I was diagnosed with adenocarcinoma of the colon. So colon cancer.
It's certainly not the diagnosis anyone expects, especially at such a young age. Jonathan Bialis is only 28 years old. He tells me it all started with a pain in his abdomen in the middle of the night.
That just kept getting worse and worse and worse until eventually I had to go to the emergency room. They told me I had diverticulitis, which is, for those people who don't know, it's like a pocket in your intestines. They thought it became inflamed.
After a visit with a gastroenterologist and a colonoscopy procedure later, doctors found a tumor wrapped around Jonathan's colon. A biopsy showed it was cancerous, stage 3.
He is 28 years old. He is a very young patient. Unfortunately, it's something that we're seeing not uncommonly.
Dr. Marianne Cusick says it's a trend that started over the last 8 to 10 years. Right now, it's unclear what's causing young people to develop colon cancer.
There's about a 1 in 3 chance that unfortunately, I'm not gonna make it 5 years, which is, it puts life in perspective when, you hear people talk about how awful it is getting older, and I just really wish I could make it to 35.
Jonathan is doing what he can to increase his chances of survival. Before his diagnosis, Jonathan was once a heavy smoker and moderate drinker. He's also lost weight and changed his diet.
Jonathan's cancer had already spread, so it wasn't just involved in the colon. It had started to be on the move. It had started to be in the lymph nodes. It had not reached the blood supply or other organs yet, and that definitely changes the survival rates.
Dr. Cusick says Jonathan will begin chemotherapy soon, which will increase his survival. He just needs to be monitored more closely.
It happened to me, it can happen to anyone. People like to think of cancer as, an old people disease, but it's not.
For more information on this story and our series with UT Physicians, head over to khou.com/healthmatters. For KHOU 11, I'm Kimberly Davis.